Everyone. My name is Priya, and today I'll be talking about my research, which is on the early detection of polyneuropathy in patients with hereditary transthyretin amyloid cardiomyopathy. So before I get started, I'd like to talk about amyloidosis. Amyloidosis is a rare disease that's caused by misfolded proteins, also known as amyloids, that end up being deposited in the heart and our nerves. As a result of this, patients may display cardiomyopathy and/or polyneuropathy. So for those who display cardiomyopathy, what we normally see are dizziness, shortness of breath, and fatigue. And for patients who show polyneuropathy, we normally see carpal tunnel syndrome, tingling, and numbness. There's one type of amyloidosis that is the most common type that we see in patients, and that is transthyretin amyloidosis, also known as ATTR. There are two subtypes of ATTR. One is wild type, which is normally caused by aging, and the other is hereditary, which is caused by mutation that is passed in families. Unfortunately, there is no cure for this disease. However, there are treatments that are available that can help slow down disease progression. And one of these treatments are patisiran and inotersen, which are novel therapeutics, and they are TTR silencers, or transthyretin silencers. The purpose of my study is to determine the prevalence and clinical features of polyneuropathy in patients with hereditary transthyretin amyloid cardiomyopathy. So I'm looking at patients who have the hereditary subtype of ATTR, who only present the cardiomyopathy phenotype. In order to do that, we first have to identify patients who have hATTR-CM. So first, patients would undergo a PYP scan or endomyocardial biopsy to determine if they have ATTR-CM. The more preferred method is a PYP scan, as that is not so invasive, and that is a test specific for ATTR-CM. Then patients would undergo a genetics test to determine if they have the hereditary subtype of ATTR. From there, patients who do have hATTR-CM would then be referred to a neurologist who would conduct a physical exam and nerve conduction studies to determine if they have polyneuropathy. So what we found was that there was a total of 60 patients with hATTR-CM. And of these 60 patients, 40% of them continued to show the cardiomyopathy phenotype. So they did not show any signs of polyneuropathy in either assessments. However, 50% of the patients showed signs of polyneuropathy in both the physical exam and the NCS, as well as neurological symptoms. So what this means is that they have a mixed phenotype, as they both have a polyneuropathy phenotype and the cardiomyopathy phenotype. Lastly, there was 10% of patients in which they did not show any signs of polyneuropathy in the physical exam, nor did they show any symptoms. However, they showed signs during the NCS. So what this means is that there were amyloids present in the nerves, however, it wasn't significant enough to produce any symptoms or signs in the physical exam. I looked more closely at the patients who showed signs in both assessments. And what we noticed is that, for the most part and most of the parameters in the physical exam, they had normal results. However, at least 50% of them showed abnormal results in the ankle reflex, knee reflexes, and pinprick. So it's more so in the lower extremities that they showed signs of polyneuropathy. I also looked closely at the NCS of these patients, and as expected, they did show signs of polyneuropathy in the lower extremity and length-dependent polyneuropathy. So what this means is that there were amyloids present in their lower extremities and their feet, and so that's why there were more signs of polyneuropathy during the NCS. However, what was interesting was that 70% of the patients showed signs of polyneuropathy in the upper extremities. So what this means is that amyloids are present in the nerves in the upper extremities. However, it wasn't significant enough to produce any symptoms or signs during the physical exam. What I was able to conclude is that 50% of the patients showed signs of polyneuropathy in both the physical exam and the nerve conduction studies. However, 10% of them only showed signs during the NCS. So as a result, a total of 60% of the patients could be treated with the novel therapeutics, so that's patisiran or inotersen. And therefore, patients with hATTR-CM should be referred to a neurologist for routine assessments. Before I end it off, I'd like to acknowledge my master's supervisor, Dr. Delgado, for guiding me throughout my master's. I'd also like to thank my colleagues, Dr. Loza, Natalia, and Faria, for assisting me with my study. That concludes my presentation. Thank you for listening.